Good evening, everyone. Thank you so much for joining us this evening as we continue our wonderful conversations with beautiful Black women about Black women in COVID, a moment in time. Tonight, we are graced to have with us Patti Colston from the California Student Aid Commission. Patti is a information officer, and she's going to give us some information about the state of education. Of course, the narrative is that Black women are facing too many hurdles to actually survive and recover from COVID. So we have taken this moment to talk with Black women, to check in and to see how we really are doing. So thank you, Patti Colston, for joining us this evening. Would you like to introduce yourself?
It's my pleasure to be here, Carmen. I really appreciate this opportunity. I am an information officer too for the California Student Aid Commission, now going on my 9th year. And our mission is to make post-secondary education, whether it be career technical training, college education, certificate programs, accessible for low-income families across the state of California. And because of the COVID emergency, there are programs available that can help support the needs of African American women and their families through grant funding. And there are some programs that I'd like to go over. And because now enrollment rates are down, and enrollment now, classes can be taken online, and some classes are in person, if some are hybrid, but it makes higher education even more accessible than ever before. So even though COVID has been terrible and there have been terrible things that have come out of it, there have also been some blessings.
All right. So tell me, Patti Colston, how are you doing? How has COVID affected you?
Well, I'm glad you asked that question because since this emergency has taken place, the governor has taken about 10% of the state workforce and transferred our assignments to counties because the escalation of COVID happened so fast and it was so great, the counties couldn't hire enough staff to carry out their missions. So they took people like me and reassigned us, trained us through UCLA and UCSF Virtual Training Academy on COVID. And actually, they've been giving us weekly trainings ever since June of last year on all the newest information. We have Dr. Galley, who you may have seen with the governor on press conferences. He's been part of our training, as well as doctors in everything from aerial particle distribution to the vaccination, the vaccines. So I've been able to learn about interesting things that I would never have the opportunity to have known before. And then every day I get cases that I reach out to, and I talk to COVID positive families about their health, about their support and resources for their families as they go through this very traumatic crisis that COVID brings. And most families, one person brings it home and then the rest of the family becomes infected. And then you have that domino effect. So I feel very fortunate that I'm really part of this team at a historic time. And I'm able to help families all over Sacramento County, but I work with a team that serves families all over the state.
Well, I'm going to digress a little bit because I'm looking at your T-shirt and it is so. Can you just? I love it. I love it. Woo! Yes. Okay. Yeah. So this next question, you're already starting to answer it, but the question is how has COVID affected the work that you do?
Well, COVID has completely changed the work that I do because right now I'm serving as a public health nurse. So I work with a team of nurses, doctors, and resource coordinators. My background in training, my degree is in mass communication and television production. I've been a news producer and I've been a producer and a publicist most of my career. So this is divergently different, but it's so
Wow.
rewarding. For example, I had a guy, African American, he got COVID and his house burned down.
Oh my.
He caught COVID. He has 80-year-old parents. They let him stay at their house while he was in isolation. He also has a 22-year-old daughter who was in quarantine. And he got out of isolation, and his parents said, "You have to go. You can't stay here." So he was living in his car with his
Hmm.
22-year-old daughter. And he
Oh
was in crisis.
my.
Yeah, he was still recovering. He was homeless and he was living in his car. His family had kind of washed their hands. So I was able to get him connected with a collaboration of nonprofits, and he was able to get financial assistance and a hotel room. So that's what I love about this work. We bring together nonprofit community groups, and along with the counties, we provide everything from mental health support and resources to critical care connections with providers. I run into a lot of African American families that don't have medical insurance, and they don't know that their COVID related expenses are covered. Even if they don't have, Kaiser or Blue Cross Blue Shield, they can have Medi-Cal and have access to the same types of medical care and support that someone who might be paying the premiums, out of their pocket would have, which
Mhm.
is another really amazing thing. I have an elderly couple. She's 72, he's 91 with
Oh my.
comorbid conditions. So for our community, if we have diabetes, high blood pressure, asthma, any kind of chronic condition, COVID will have a more serious impact on your body because
Right.
you have these comorbid conditions. So she got it, he got it, and they were fortunate enough to have medical coverage that provided them with monoclonal antibody infusion treatment, which is
Oh my.
it's pretty amazing. It's the way that they infuse the antibodies into the bloodstream in order to minimize the symptoms and hospitalizations and ultimately death. So this couple went through that treatment, and it was just amazing how, depending on your access to healthcare, it will have a huge impact on your symptoms, whether or not you're hospitalized, and ultimately your mortality. So I really applaud Black women for wellness, for what you do to help connect African American families with wellness.
Well, just sitting here talking to you, you have introduced several pieces of resources that I don't think most people have heard of. And so, just kind of to recap, we've got one more question, but I'm hearing and I'm seeing, it's almost like you're glowing. So, which is, totally contrary to the narrative about Black women and what we are going through and how we are existing and living through this moment. I mean, I'm talking to you now, and what has come out of COVID for you is that your territory has been enlarged, and now you are able to serve. You are already a wealth of information, but now you are on the front line. I mean, actually engaging and changing whole families. Not just that one college student, but you are engaging and bringing resources to entire households. That's just amazing. When everybody is suffering, isn't that amazing how there is something that you are, that somebody who is now going from and dropping these seeds of good. And that's just an amazing position to be in. So,
Yeah,
congratulations on that.
I appreciate that. I never expected to be in this position.
Isn't that amazing? And you wear it well. You look fabulous. You really honestly look amazing. You would not know that we are in the middle of any kind of pandemic or tribulations or trials right now. You look amazing. So I'm going to, our last question, which you kind of already hit on, is what is the best defense that Black women have to recover from this disease and to survive?
I would say take advantage of all the free resources that are available. You know, I talk to some African American families, and sometimes there's that little, you know, pride, and
Mhm,
we want to parlay that pride into power,
mhm,
because right now there's federal funding available for funerals, there's federal funding available for sick leave in the state of California. There is the 211 operator system. There is community testing, community vaccine sites. Only 3% of the vaccines distributed in this state are to Black people. Right now, 31% of white people have been received at least one vaccination,
mhm.
compared to 3% of Black families. So we want people to take advantage of the free community testing sites, the free vaccine sites. I may have mentioned that the state has provided an extra $6,000 in financial aid. If you're taking classes online at a community
Wait,
college,
wait, 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 wait. You're
yes,
going to
ma'am,
have to say that over again and say it a little louder because we need that.
there's an extra $6,000 available for students with dependent children. So if you're a mother and you have custody of your child for at least 50% of the time,
Mhm.
then you can fill out a form when you fill out your FAFSA, and that will make you eligible for an extra $6,000 in financial aid. If you go into a community college and you're in your last year, if you take 12 units, you can get an extra $1,400. If you take one more class, 15 units, they'll give you an extra $4,000. So
My
if you're a
God.
single mother, there's 10,000 free dollars
Come on
off
now.
of your state Cal grant, your federal Pell grant, which is 6,000, and your Cal grant, which will be between 1670 if you're a community college, all the way up to 13,000 if you're at UC. And you can take those classes online. You never have to leave your home. And you're going to get the same financial aid and even more than you would have gotten in if you were in classes and in the seat.
My God.
So this is a great opportunity. Also, counties are providing free everything from thermometers, masks, gloves, um, even transportation in some cases to get to your testing or your vaccine sites, and it's all free of charge. We're providing food, prepared meals, food boxes from the food bank, as well as chef prepared meals for people who are in isolation or quarantine. It's all free. So
So
I
Patty,
say,
is there a link? Can you give us a link? I mean, this recording and this interview is going to be posted to our website so that people can actually access your link and hear about these resources. But as far as them actually applying for any of these amazing opportunities that are out here to flourish and to thrive, because we don't just want to survive, we want to thrive. So, I mean, this is actually setting us up for even beyond, not just to live in this moment, but beyond COVID. So, this is amazing. Is there just one link that you can give me as we end this interview that we can share and immediately upload to our Black Women for Wellness website? Because I cannot wait for you to actually come and to come on. You guys, we're going to go live at least twice a month during this campaign. And Miss Patty, you know she's going to be with us and she's
I'll be back.
give this information and we're going to talk about it because you know everybody has these horror stories about going back to school and oftentimes people don't return back to school because they just think they don't have the capacity between cost and books and I've been a student and so I've done classes even without books but you're talking about stuff that I'm sure some of this was available even to me that I just didn't know. And so, can you give us just one link or something that those last resources with the food bank and and meals, where does one go to apply for that?
One would go to their county health department website. And
Okay.
that applies to both people who are COVID positive and people who are in quarantine because they've been in contact with someone who is COVID positive. So get in contact with your local county health department, and there's 58 health departments in 58 counties. That's a great way to do it. And then you can also give me a call. My cell number is 916-661-2654, 916-661-2654, and call anytime between 9 and 5, and I'll do my best to get you connected with whatever services or resources that may be of assistance.
I appreciate it. Thank you so much for joining us this evening. You have been a wealth of encouragement, first of all. And that is really one of the goals of this campaign, is to instill hope, to give these stories of triumph so that we as Black women um, get just a little more energy and just a little more um, support as we, navigate through this horrible pandemic. But even as horrible as it may be, there is so much good that has come out of this. And so, if we need to just encourage people, like I encourage myself, I don't care how bad the situation looks. If you look long enough and deep enough, you will find some good. And we have certainly found good with you this evening,
Thank you.
Ms. Patti.
It's my pleasure.
Thank you for joining us this evening. And thank you, everybody, for being with us for this interview on our school time segment with Patti Colston from the California Student Aid Commission. Thank you again, and
You're
good
welcome.